some things that are being requested also are around the tools of how they can manipulate information. And I think there's still a lot here to learn about what type of tools can be provided on a mobile device, and what types of mobile devices are going to aid some of this better than others. I will just share a few stories about what we're finding. We started going into the field and watching people in their work settings. Like I was saying, I think back around 2003 to 2004. This is a recent picture here, however, of actually what's going on here. This is in an A&E room or an emergency room in a hospital. And off to the other side, there's a patient who's come in who was hit by a car. He was a bicycle messenger. And over here you can see another doctor just in the corner. They're preparing stuff to stabilize this man who is about to have a near-death experience. It does all work out well. And what I focused on here is, you still have the stacks of paper. You still have, the integration into the hospital here. They've taken a tablet PC and anchored it down on a cart that they can move around from bay to bay within this room. And on this cart, or what's on the screen here right now, is their electronic health record system. And they're going to start inputting in the patient's information, finding out who they are, what potential interactions will they have. For instance, this bicycle messenger happened to be doped up pretty highly. He wasn't feeling a lot of pain, even though he probably should have been. So there's a lot of concerns about, what kind of medical drug interactions would they have, depending on how much anesthesia could they give him or not, or just other medications for treatment. And so knowing about how they're using these sorts of things in this sorts of context, we can figure out how we can put in our information at that critical point so that they can have easy, quick, seamless access to make that decision quickly and confidently and continue on with treating this man. This is another time here. I happened to be working with this physician. He was an orthopedics physician, as a resident actually. He was in his 4th or 5th year of training and practice. And one of the things that I was finding out from watching him and his colleagues is that the way people are using their mobile devices is it's very inventive. People are really adapting to different situations. He, for instance, liked to take pictures of really damaged joints and anatomical parts for case reports, to share with his colleagues, to educate other people. And he would also use it to transfer information between shifts. This became very, very important. Even though if you're in these types of settings, there's always a transfer of knowledge between professionals when they're working together. Physicians are no different, but when they can share this sort of imagery, you can kind of make it a little bit easier. So yeah, this is really very fascinating. I had not really considered this, but it also gives us some insight into other opportunities to perhaps work with our users to create, for instance, image libraries, let them create other means of sharing information from their practice with each other. And in another instance, just really going into a different medical sort of situation, another clinical situation, and an outpatient visit where you just go in for your annual checkup. There was one day where I was with a physician, and 4 out of 10 patients, they were men, had come in just for their annual, somewhat frequent checkup. They had been given a medication called Viagra. And some of them had questions about the cost. Some had questions if they could double up their dosage or if they could switch to something else. And so what the physician would easily do is take his phone from his pocket and look up the information to see what would be possible. And he was able to do it very unobtrusively and very quickly while not stopping the patient interaction. He was able to pull up this information so that he could discuss it with each of the patients, and then together they were able to come to a decision. Okay, so I have just some screenshots of some things I was going to show you. Some of them I'm pretty sure you will have seen already, so I may go a little bit quickly. If you have interest, just slow me down. Again, this is, in the background image here, just a picture of the process that we go through when designing these things. This actually dates back to 2002. This is back when we had Pocket PCs and Palm Pilots, if you remember those. They synchronized with a cable to your desktop computer. It was a different era. And this is from a project where we collaborated with a group called the European Society of Cardiology. They were interested in taking their information and making it more interactive, but also available to their physicians. There was a period back around 2003 where the death rate was actually quite high. So the hypothesis was, if we can put information, I should say the death rate within cardiology wards when you were coming in for some cardiac distress, that if we made it easily available where you could, where they could take it with them to the patient's bedside, or actually when they were coming into the hospital from the ambulance, and have the guidelines available on what the proper protocols were, that the death rate and error rate would lower. So what we did was put it on a tablet PC, and we ran a couple different examples of having data synchronized and fully loaded on the device, and another one where it ran on a wireless network. And we actually provided that wireless network to them to see how this would go. And it went really, really well. But some of the things that you had to take into account is, at this time, you didn't have the ability to touch it with your finger. You had to have a stylus. You had to be able to touch it with a little pen. So having large targets to interact with in a potentially stressful situation, these sorts of things were important. And how we dealt with the data was also very important. So here is a situation where someone perhaps is looking for a diagnosis. We had to formulate the content at this time so that you could pick out the variables which were within your context at that moment. And then the information would come back within a sentence or a paragraph. On the health sciences side, we've got lots of apps and optimized websites that are available today. I can't tell you exactly how many we have. I know it's over 31 that are available right now, and there's really more coming. And they're for so many different needs. And I won't go into all of these necessarily, but some of these relate to just studying, continuing education, and staying sharp in your trade, just to doing clinical references, drug lookups, and more study. This one happens to be just a clinical point of care sort of information. I'll touch on it a little bit more at the end because it relates to voice interaction. And then you've seen these and some nice demos, so I'll go past this as well. So that last one that I pointed out was related to voice recognition and voice navigation with a device. From that last project I was telling you about with the tablet PCs that we were doing with the European Society of Cardiology, we were working with what we had at the time for easy interaction, quick interaction. But over the years, voice navigation has become much more accurate and much more practical. So I think sometime in the first quarter next year, and within a few months, we'll be launching a beta of a new concept where you can just speak what your query is. And it's working with a special set of content and data that's tagged up and marked up in a particular way, so you can kind of bypass the search results and go directly into the information that you're looking at. And so it should be pretty cool. Yeah, I couldn't show you the pictures of that one. Sorry about that. I think that's it. Yeah. So thanks for your interest.
Thanks, everyone.